Hello class! Today I'm going to do my presentation on mucopolysaccharidosis type 1 or MPS type 1. Quick little overview for the presentation. I'm going to start with some history about MPS type 1, which I think is important because, as I'll describe later, the disorder is on a spectrum. A little bit about what MPS type 1 is, the symptoms and characteristics, the genetics of MPS type 1, its pattern of inheritance, which was that pedigree analysis that we did for Project 3, the genetic testing options that are available for patients presumed to have MPS type 1, the treatment options available for patients who do have MPS type 1, and then I'll conclude. And I've got my references as the final slide, and you can see it's down here in a purple bullet point because in addition to my in-text citations, I'll also provide where the resources came from in purple text in the bottom of each slide. Jumping into the history, it was in 1919, German pediatrician Gertrude Hurler observed infant patients with some pretty interesting facial deformities, as she would describe them, and this came to be known as gargoylism. And the first name for MPS was actually called Hurler syndrome. And it wasn't until 1962 another physician, Dr. Harold Schei, described patients who presented with more attenuated symptoms of Hurler syndrome. So it got the name Schei syndrome. And this was primarily corneal clouding. It was later observed that there were patients who presented with symptoms that kind of fell in between Hurler and Schei syndrome. So if you look at my next bullet point, MPS type 1 sits on this spectrum. You've got Hurler syndrome, which is the most severe form, Hurler-Schei syndrome, which is kind of the intermediate form, and Schei syndrome, which is determined to be the most mild form. And again, these symptoms of MPS type 1 that were pretty much gave it the initial diagnosis were these gargoylism symptoms. And this description kind of came from some of the facial deformities that were associated with the disorder. And as you can see in this picture here, this is those gargoylism features. You've got this frontal bossing of the forehead region. You've got the depressed nasal bridge and the gap teeth, which you can't really see too well in this picture, but most patients with MPS type 1 have very kind of wide and displaced teeth. And then you've got this thickened tongue that's associated with some of the nasal issues and the airway issues that patients with MPS type 1 have. So what is MPS type 1? As research has advanced and we've been able to develop a better understanding of the disorder, it's been discovered that it's what is called a lysosomal storage disorder, meaning there's issues breaking down some of the recycled materials that go into a lysosome. And it's specifically these large sugar molecules called glycosaminoglycans, and the specific ones associated with MPS type 1 are heparin and dermatan sulfate. And for those that don't know, lysosomes are these cellular organelles that contain these kind of digestive enzymes that are responsible for breaking down all these kind of end products of certain metabolic and chemical reactions that occur inside the cell. And they can even destroy invading pathogens that enter the cell. So, as we know, most of our cells in the body, if not all of them, have lysosomes. So this disorder affects almost all of our bodily organs and systems. So I kind of wanted to talk about each one and what are the associated symptoms with them. So heart and blood vessels, you kind of get these heart valve diseases, these abnormalities in heart muscle, which are called cardiomyopathies, and abnormal heart rhythms or arrhythmias. And then you get valve thickening, which can also be tied back with the heart and valve disease. Then the GI system, you get these enlarged abdominal organs, and it's primarily the spleen and pancreas. You get inguinal and umbilical herniations, diarrhea, and constipation. Respiratory symptoms kind of include sleep apnea, noisy breathing, nasal discharge, dysphagia or difficulty swallowing is what that means. Very common to see lung and respiratory tract infections as well as these enlarged vocal cords. And in the endocrine system, you get precocious puberty, which is early onset puberty, and that can prove to be a pretty difficult issue for individuals who do have this. And in terms of the musculoskeletal system, you kind of get the malformed neck, which we saw back in that picture of the patient with gargoylism, stiff joints, skeletal deformities like scoliosis and kyphosis. Scoliosis is that lateral curvature of the spine that kind of gives you the S or maybe a C shape, and kyphosis is that posterior curvature of the spine that gives you kind of that hunchback look. You get carpal tunnel syndrome, claw hands, abnormal thorax shape, hip dysplasia, deformed feet, and kind of delays in motor function. For the mouth, teeth, and eyes, we get that enlarged mouth and tongue, which we again saw in that previous picture. Displaced teeth as well. Corneal clouding, which is what Dr. Schei described in his patients. retinal degeneration, and glaucoma, which is that pressure that builds behind the eye. And for the brain and nerves, you get hydrocephalus, which is swelling of the ventricles. Often patients with MPS type 1 might undergo what's called a ventriculostomy or a VP shunt placement, which allows the cerebrospinal fluid that's swelling in the ventricles to continue circulating. You get cervical spinal cord compression or cervical myelopathy, which is the primary source of the patient's sensory and motor functions or dysfunctions. Short-term memory loss, and again, carpal tunnel syndrome can kind of fit under here in the neurological issues as well. I wanted to include this picture from the National MPS Society because, again, it just further describes how MPS type 1 sits on a spectrum. And so we see all of these different symptoms and how patients with Hurler syndrome, they've got all the symptoms present and in their most severe forms. The more plus signs you have, the more severe the symptoms present with. And, Shy syndrome here is kind of not all the symptoms are present, and they're not all in their most severe forms. And Hurler Shy would fall kind of in the middle here. It's just so variable that it was kind of difficult for them to make a chart. So the genetics of MPS type 1 is it's these mutations in the IDUA gene, which encodes for an enzyme called alpha-L iduronidase, and they're what are responsible for the disorder. Often mutations are missense or nonsense mutations, and I think if you get those nonsense mutations, they're more associated with the severe forms of the disease because you get no enzymatic function, whereas missense mutations kind of might decrease enzymatic function by, let's say, 25% or maybe 75%. It's all variable. And then this enzyme is responsible for breaking down those glycosaminoglycans that I talked about earlier, heparan and dermatan sulfate. The location of the gene is 4p16.3, meaning it's on the 16.3 band of the short arm of chromosome 4. And it's inherited in an autosomal recessive pattern and has no association with our sex-determining chromosomes. And since, again, it's autosomal recessive, if parents are to have an offspring who is afflicted with MPS type 1, that means, one, they're either affected or they're a carrier for it. You have to get one mutant copy from each of your parents. So here's the pedigree analysis that I made for Project 3. And you can see here individuals with the pink dot kind of in the center are carriers, and individual with the red square are afflicted with the disorder. And so you have to have either two carriers to produce offspring who are afflicted with the disorder, or if you're afflicted and mate with another carrier, you can produce an offspring with the disorder as well. In this pedigree, I did not have any reproduction occur between individuals afflicted with MPS type 1 because it is often clinically recommended that they do not reproduce. So the genetic testing options that are available for patients with MPS type 1 are presumed to have MPS type 1. It's kind of interesting. They like to start out with what's a urinary analysis to look for those elevated levels of heparan and dermatan sulfate. And if the urinary analysis shows this, it still is not a definitive diagnosis for MPS type 1. There are other disorders that are associated with glycosaminoglycan buildup. If there are elevated glycosaminoglycan levels, they move to molecular genetic testing, and it's done on the white blood cells and skin cells to give a definitive diagnosis. The reason they do white blood cells or skin cells is because it's a very non-invasive form of testing individuals' DNA. And the reason you can't do red blood cells is because red blood cells are anucleate, and so they have no DNA and don't make any RNA. The standard is multi-gene panels, and basically over the years as they've tested individuals with MPS type 1, they've been able to build this categorization of the mutations associated with them, and it's helped patients who are diagnosed with the disorder find out where they lie on the spectrum. Enzymatic testing can also be done, but this type of test is not as accurate at identifying where the diagnosis lies on the spectrum, because even patients who, let's say, have just 75% of the function of the alpha-L iduronidase enzyme, they can still present with the more severe forms, Hurler syndrome, whereas some patients who have maybe just 60% function might fall in that Hurler shy category. So it's best if you use the multi-gene panel to really give yourself the most accurate diagnosis. The treatment options. So the big one for patients who have the mild or attenuated form, so that'd be shy or Hurler shy syndrome, is enzyme replacement therapy, and it's the use of a synthetic enzyme that can break down those glycosaminoglycans, and it's been proven very effective at kind of mitigating symptoms and improving the lifespan of patients with MPS type 1. The one downside to it is since it's ingested, it cannot cross the blood-brain barrier. Therefore, neurological symptoms are not able to be treated with this method. We know the blood-brain barrier is this very highly selective kind of barrier that it makes it difficult for patients with, let's say, any sort of neurological cancers or tumors. It's just very hard for drugs to get in there and attack those tumors and cancers. For patients who have Hurler syndrome or the most severe form, it's recommended that they undergo hematopoietic stem cell transplants. Basically, stem cells are harvested from a healthy donor, and there also has to be a match. You can't just take stem cells from anyone. And they're infused into the bloodstream, and they travel into the bone marrow and basically will produce healthy enzyme-producing cells. And again, this is primarily used for individuals with just Hurler syndrome, and it's not recommended for individuals with Shy syndrome. So to conclude, wrap everything up, MPS type I is this lysosomal storage disorder that again sits on that spectrum, with Hurler syndrome being the most severe, Hurler Shy being intermediate, and Shy being the more mild form of the disorder. And it's associated with the buildup of those glycosaminoglycans, heparan and dermatan sulfate in the lysosomes. Inheritance pattern is autosomal recessive disorder, meaning, again, you have to have two parents who either have a mutant copy or a carrier or afflicted with the disorder to produce offspring that will have MPS type I. And it's that lack of or hindered alpha-L-iduronidase enzyme that results in that glycosaminoglycan accumulation in lysosomes. And genetic testing options are available, and they are capable of identifying where individuals with MPS type I sit on the spectrum. And to treat patients, you use enzyme replacement therapy or that hematopoietic stem cell transplants. And again, treatments have had very positive impacts on the patients who have had MPS type I, and they have significantly improved quality of life and lifespan. Here are my references, and thank you guys so much.